dignity, comfort. These are some of the words used to describe hospice. Community volunteers are working to provide this special kind of care for the terminally ill in an atmosphere unlike anything else in Southwest Georgia.
I don't think there's anyone we have approached that in some way, shape, or form hasn't been touched by hospice. I know in my personal case, both my mother-in-law and father-in-law were supported by hospice. And it is an easy sell only because I think there is the desire in some way to give back to this wonderful organization for the patients and the care and all the attention given to these people who are in their final days.
Both my parents passed away within 9 weeks of each other.
Albany businessman Rick Doherty's parents, Richard and Betty, passed away at an inpatient facility in Atlanta.
My mother was diagnosed with lung cancer and fought it for 4 years, so went through a process with hospice for a very, very long time.
Due to the care required during her illness, Betty Doherty split time between her children's homes in Albany and Atlanta, and even at times was at her own house in Warner Robins. Hospice was with her the entire time.
Hospice worked great with us during that process. They didn't care about the paperwork, they just made it happen, whether she was in Albany, she was at home in Warner Robins, or she was, in Atlanta.
But it was in Atlanta, hours away from Albany, where the family discovered an inpatient hospice facility. But it wasn't Betty Doherty who needed this special kind of care first.
My dad died rather suddenly from complications from a fall and a hip fracture. And we ended up going to hospice because we knew about it because of my mom's cancer situation. We went there with Dad, and Mom saw firsthand just how wonderful that it was, and we all saw firsthand. So she was, through that process, had learned herself about it.
9 weeks after Richard Doherty passed away, Betty Doherty asked to be taken to the same place.
She mentioned to my sister she was staying with her at her house and said, well, I need to go in. I think, I think it's time. My sister said, you mean the hospice house? She said, yeah. What a better testimony than that? I mean, she saw it firsthand and she wanted to go there.
With the support of people like Rick Doherty, the option of inpatient hospice care will one day be available for all families in Southwest Georgia. The Willson Hospice House, named in honor of community leader Harry Willson and his family, will be special to our region.
We want it to feel like it belongs in Albany. It should be a part of this community. It should feel at home here. But it should also be a little unusual because the program is itself unique. So what we don't want really is to be an architectural big house. What's going on inside is unique, and we'd like for the architecture to give some subtle clues that this is something very special.
The Willson Hospice House will not be a traditional clinical setting. The facility will be very much like a beautiful home.
What we need are porches, we need sunlight, we need places with breezes, we need a windowsill big enough for the cat to spend the night on, we need a room that's large enough for the family members to spend the night, we need warm and inviting spaces with views out so that they know that there's a connection with the indoors and the outdoors.
The design will encompass space for 18 patient rooms, large enough for families to gather or even spend the night, with doors opening into the family room and kitchen. There will be a chapel for prayer and contemplation, a library, a well-equipped playroom for children, and even special spaces for bereavement classes and for families to meet privately with their care delivery team. Beautiful gardens will surround the building, peaceful areas where families and patients can enjoy the serenity of nature. All of the medical services available for the patient will be discreetly hidden away so they are easily accessible but not prominent, adding to the quiet and home-like setting of each room.
We're trying to put together an environment that helps the staff do their job as well as possible and delivers first-class health care in a building that doesn't feel like a healthcare facility, a building that feels like a place where you can draw a deep breath and relax and know that people have been through this before and can help you go through it now.
My initial thoughts about the Willson Hospice House were, what a great thing for Albany. The longer I've been on the program, the more the stories that you hear about people that use this type facility. You know, it's not only older people, it's not just children that are young, it's every age group that you can think of, even my age group.
It's a great unknown going through death as a child with your parents. It's a great unknown, but I've been on the other side of it now, and it's just, there's no question that we need it. Albany needs it. Every place needs it.
The benefit that we see in terms of this hospice house has far-reaching effects in terms of creating community pride. It'll be an attraction to folks who are considering moving to Albany, and most importantly, it will provide a respite for people who are in their final days. I just can't be more proud of what we're doing here.